Good morning, I am Dr. Dheeraj, consultant hand surgeon, Germanten Hospital. Today, I'll tell you about hand surgery. So, you must be listening about this hand surgery for the first time because hand surgery is a subspecialty of orthopedics. So, after orthopedics post graduation, we do this subspecialty. It's recently upcoming fellowship or super specialty we call. So, like spine surgery, like sports medicine and other arthroplasty, knee replacement fellowships, we also get trained in hand surgery. So, what is hand surgery? In hand surgery, is it just about hand? No, it starts from the neck, from the brachial plexus, nerves which start from the neck, and it goes on till the hand. We see multiple conditions, wide variety of conditions in this hand surgery practice. So, what we see regularly are fractures. We see fractures related to hand, wrist, forearm, and elbow and shoulder. And we see problems related to fractures which are not treated properly. Like people go initially for native bandages and come after some time, after a few weeks. Then the dealing of fractures will be very difficult. We deal those kinds of fractures, and people come with stiff fingers, stiff wrist after treatments which are not properly done. So we deal those conditions, stiff conditions, and we also deal regarding finger cut injuries and wrist injuries. We repair the tendons which are cut in the hand, wrist, and forearm, anywhere else. And we also deal regarding the nerve problems. We have a bunch of nerves called brachial plexus in the neck region. So after road traffic accidents, we see people coming with paralyzed hand. So they cannot lift their shoulder, they cannot bend their elbow, they cannot move their fingers. So this is called brachial plexus injuries, and these are not treated in all the hospitals. They should be dealt by a hand surgeon. So we operate under a microscope. We see the nerves which are damaged and we join them using a microscope. And we also deal with replantations. Replantation surgery is called reattaching the cut part. So accidentally, some people might have kept their finger in a machine or a mixie, and the finger completely comes out. So what we do is we attach the small vessels, small nerves using a microscope. So that is done in this hand surgery specialty. So it also deals about nerve compression problems in the forearm or in the wrist, carpal tunnel syndrome we call it, and cubital tunnel syndrome. There are multiple nerve problems, and we also do nerve transfers, tendon transfers. These all are complicated procedures, and this needs to be seen by a hand surgeon. So hand surgery is not just about hand; it's a lot. So be aware of hand surgery and hand problems, and consult a hand surgeon nearby if you have some problem. Thank you so much.